Hey guys, Nick and Laura again with our Wellness Wednesday, Dr. Google, what to look for when Googling your shoulder pain. Uh, we have moved on to a different article from Harvard Health Publishing, another really reputable source. And we're going to go through and see if there's anything that you should be aware of. So here we go.
Let's check it out.
Let's check it out. All right, so it says what to do if your shoulder hurts. And then it breaks it down.
Yeah. Again, I don't think there's a lot in here that's going to help a lot out. It says like if you do not experience shoulder pain, it's not always possible to figure out the cause. That sentence, I don't quite understand it. But outside of that, right, there's going to be things that are going to be, like, again, it does say good things. Like you can get radiating from the neck, which is absolutely true. Like we're going to see that on a fairly common basis. A lot of people injured yourself or don't know you're injured yourself, right? Hey, if you don't know you're injured yourself, you really might not. Like you take a wrong step. Obviously, it's a little bit different, but you reach wrong, and you might not notice that you tweaked something, you irritated something.
Yep.
But really, overall, like it says, like adjusting activities, take your NSAIDs, do mild stretches, but you don't necessarily know what those stretches are. So that's why I said I'm always hesitant to just say, yeah, stretch it out or do some exercises.
Yeah, it's really hard until you know the cause, right?
Or just like the different, not even the cause, like the cause of both what is the diagnosis, which it looks like we're going to go over here, but just because that's the diagnosis and that's what's irritated, that doesn't mean that's actually the cause of what's going on too.
Okay.
So yeah, case in point here, rotator cuff impingement. It says like when there's irritation of some sort to the rotator cuff. And yes, that's true. But that really, and same thing with the rotator cuff tear. So actually most tears that we see in the office, and I think it goes on to like here, okay, like a lot of times it's an injury or something like that. No, usually it's caused because of wear and tear. As you get into your 50s and 60s, 70s, 80s, like really by the time you're in the 50s, a lot of people are already experiencing minor rotator cuff tears without even knowing it. And it's because a lot of times we talk about just before, like in another episode here is like that posture. Everything gets forward. You're reaching around. Your whole shoulder complex just can't open as well. And that's where we get this impingement. And it's just, if the shoulder blades aren't moving properly, they don't get out of the way, and you just kind of bang that ball and socket on all the tendons and everything. And that's just what starts to wear them out and either causes impingement or eventually a tear.
I see a lot of my volleyball friends have issues with rotator cuff, myself included. It's, I can't tell you how many times we were in the gym and we just had a big pack of ice on us because we were hurting. But yeah, so it's athletes too, and it's something that you have to use constantly.
Yeah, the calcific tendonitis, I'm not even really going to touch on that because we see it so rarely. Adhesive capsulitis, though, is actually a big one. Also known as like the frozen shoulder. And here, this is one of those, the second you start losing motion, get it addressed as fast as possible. There's no other way to say it. Like when it's in the freezing stage, if you can address it, the sooner the better. Like I cannot emphasize that enough. I've had two patients over probably the last 2 months where they started having freezing, and the doctor's like, no, you need to go. The first one, the doc actually ordered, I think, like 5 times a week for the first 2 weeks, which this isn't something we often see. A lot of times our patients are coming around 3 times a week, but no, sometimes they'll order, and I agreed with it. Like I was appreciative of it for the patient as well. Because we got to this so quickly and we're able to address it, she's got more motion than her other side even at this point. So yeah, really we're able to get out of that and help because it was painful. It was just a complete lack of motion. But time is of the essence with the frozen shoulder.
Wow. Okay. Osteoarthritis.
Yeah, and then osteoarthritis, just arthritis, right? So most people, it's like, this is a biggie. And the arthritis is a big one with, again, keep on moving. Now, with your arthritis, is this going to probably cause some impingement and some tearing of the rotator cuff? Yes, because of all of that inflammation in there, there's going to be just irritation, like rubbing almost like over those tendons, and it's going to cause more and more inflammation. At the same time, if you stop moving, your shoulder will freeze up. You will get other problems. So this comes down to, again, comes back to kind of that scapula and that upper back posture that I talked about before. If those things aren't working properly, a lot of the times, like any of the chronic degenerative changes that take place are because of that. When it's a true just like a fall on your arm, when you get hit wrong, when it's that you go overhead and you really just feel it kind of almost go, like I'm doing like that volleyball or throwing motion, when it's just, and you just feel that sharp, intense pain, yeah, there's more of your sharp, acute tears with the word I'm looking for, excuse me. But outside of that, it's usually preventable. Like a lot of things you can do, you got to do it. And I'm sure they're going to go into exercises, and we're not really going to go into that here. I think the best way to do that would probably be like check out the Ultimate Guide, because otherwise I'm probably not going to like a fair amount of these stretches that are in here.
On to our next point.
There you go. Perfect.
Our Ultimate Guide. You go to www.robinsptwest.com/guide. They're all listed in there, including our Shoulder Pain Ultimate Guide. It's a magazine. It has everything you could need for your shoulder pain. It has self-test, causes, top exercises and stretches, as well as resources that you can look at as well. So if you want to order one, just click here to get one, or just give us a call at 610-841-3555, and we'll be happy to ship one to you, or you can come and pick one up in the office when they're ready. We're very excited to get it out there to everybody. So code word, rotator.
Rotator cuff?
Rotator cuff.
Got it. Can't wait to hear it with people coming in with that this week.
All right, guys. Well, hope this was helpful, and we'll see you next time.
Bye, guys.